the numbers here are fairly dramatic. A new study out today from the Canadian Cancer Society says the number of cancer cases is expected to rise by 40% over the next 15 years. So we're talking 277,000 people a year being diagnosed with cancer by the year 2030. A lot of that has to do with our aging population, and experts say the healthcare system needs to get ready for this influx of patients and their families who will require help. But doctors also say, and interestingly enough, that 50%, half of all cancer cases, can be prevented through healthy behaviors and policies. And when it comes to those healthy behaviors, we're not talking about complicated stuff here. A few of the changes that can greatly reduce your cancer risk include quitting smoking, that's 30% of all cancers, getting vaccinated against HPV, eating well and being active, a third of all cancers can be prevented by maintaining a healthy weight, and practicing sun safety. So no indoor tanning beds, we have seen some action on that. Melanoma is the deadliest skin cancer and the most preventable. So if your doctor tells you, here's a few things that you can do, they'll greatly reduce your risk of getting cancer, why don't a lot of people do them? Well, we put that question to Dr. Robert Nuttall.
So there are challenges with people knowing that what you're doing today can have an impact not next year, but 10, 20, 30 years down the road. So there's the awareness and education. We need policies too. It's not just an individual choice. Sometimes we need that sort of, like programs to make it easier for people, or taxes, or various government measures to make it easier for people.
So behaviors can be tough to change, and there has to be the will to change them. But just one more point about staying healthy. Getting screened is a big one, and doctors say that if 80% of people 50 plus were screened for colorectal cancer, 40,000 people's lives could be saved over the next 15 years. Christine Birak, CBC News, Toronto.